Restoring the doctor-patient relationship is key to the services provided through Guardian MD's Concierge Medical Care Program.
Concierge medicine to me is really a way to try to bring practice back to where it used to be. Like when I started 20 years ago, it was more me, one patient, one nurse, to have more of a smaller, intimate setting, allow you to spend time with patients. And today's sort of corporate way medicine works really sort of doesn't allow that. It detracts from the doctor-patient interaction.
In concierge medicine, patients pay their primary care physician a retainer in return for basic services and augmented care.
I think prior to Guardian, it was the frustration of calling and needing an appointment. You say you're sick and you want to get in this week, and you call and they say, well, we don't have an availability for 3 weeks out. Well, by then I might feel better and I may not even need the appointment. So at the Guardian program, I've seen a big change in that you can get right in when you need to.
For patients, the prerequisites vary from practice to practice, but can include more personal attention, house calls, and even the doctor's cell phone number and email for 24-hour access. Ann Mathis recently experienced the benefits of Guardian MD's program.
Saturday, I woke up and was quite ill and quite frightened by my illness, and I wanted to see how Guardian would work. So I asked my husband to call the number because this was on a Saturday morning, which most times doctors are not that available. And so he called Dr. Page's cell phone. He was able to describe what was happening to me, and within the hour, Dr. Page returned our call. And shortly thereafter, he sent me 2 email messages, with one being an exercise program that for my extreme dizziness, and the other was online material that I could read. And I experienced almost immediate results and was much better. And it was wonderful to be able to do that rather than have to drag my very nauseated body to the emergency room.
Because Guardian MD offers a tiered base fee program, patients may choose the Affordable Concierge program, which gives them the control over the type of health care they receive. Like many physicians, Dr. Carl Page believes restoring the doctor-patient relationship increases his patient's ability to avoid disease and live a longer, healthier life.
The chronic problems that people deal with in healthcare today, diabetes, high blood pressure, high cholesterol, heart attacks, strokes, they're problems that started 20 years before they came to a crisis. And if they would have had an intervention or some interaction with the healthcare provider that could have pointed in the right direction at an earlier time, maybe they wouldn't develop that problem.
I think it does help improve my health because we're working not only to resolve the health issues that you have right now that you see in your test, but we're working together to work on a prevention program for the future.
According to the American Academy of Private Physicians, the number of concierge doctors is expected to double every 12 to 18 months for the next 3 years. Patients who try this type of medical care report high rates of satisfaction.
I realize that the medical field and the medical climate is rapidly changing. And although initially I wasn't very excited about paying a fee to see a physician every month, I've more than benefited from it and more than gotten my monetary expenses back with the care that the Guardian physician, Dr. Page, has given me.